Just a few words about nasal fractures. Jack, unfortunately, had an accident with a bicycle a couple of days ago. He was seen in another hospital. And in general, you have about 2 weeks to do these. If you don't do it on the first day, you have to wait until about the 4th or 5th day for swelling. We'll do this operation under a little bit of sedation to make it easier on Jack. The slit will come off in a week, and we'll have a straight nose again. He'll be able to breathe. Okay?
Sure, sounds good.
Okay, good. He came all the way from Texas for this one. Okay? Okay. A frequent part of our practice is nasal fractures as well as larger facial fractures. I think it's important, if you have a nasal fracture, to understand the options and the timing at which it must be treated. There are 2 intervals of timing. The simplest and easiest way is to do a closed reduction of the nasal fracture, and that is where we manipulate the 2 nasal bones that are almost look like a tent. One is this way or that way, and get the midline. This can be performed under local anesthesia, but we usually do it with a little bit of sedation, just like a colonoscopy. If, however, you miss that golden interval of about 2 weeks, the bones fuse in the wrong position. Then we wait about 2 months and we do an open reduction of the nasal fracture, which is a little more invasive. It's almost like a rhinoplasty, where we take an instrument to re-break the bones and put a cast on. Either way, the cast is placed on. It's for about a week or so, and the pain level the first night is very minimal. It's a 1 out of a scale to 10. You have to keep your head elevated. And then after the splint is removed, we tell patients to be very careful for following 3 weeks because the nasal bones can move. And we can see that the nasal bones are like a tent, so that this nasal bone is broken in and this one is out. So we're just going to manipulate these bones and make them straight. Okay, great. We're about 20 minutes after the procedure is done, and Jack is sitting here. How do you feel?
I'm doing okay.
Wasn't so bad, didn't it?
Not so bad.
Well, with the sedation, he has no memory of it, but we can also do this with local anesthesia. But he's up and on his way now, back to Texas. We're now about a week after the procedure, which was the closed reduction of the nasal fracture. And unfortunately, in the interim, Jack had his hand fixed at the hospital for special surgery. So how are you feeling now?
Pretty good.
I forget the hand. How's the nose feel?
Good.
Okay, so let's take the splint off. It's a week. So we're just going to do this off gently. It's almost all off by itself. And the nasal bones are in perfect position. And the only thing that we're going to do is tell Jack to be careful for the next 3 weeks, because the nasal bones can move. So when you sleep with one of those airline pillows. And after that, it's pretty good. And be careful when you wear your glasses. Okay. So just to review, when you have a broken nose, you have 2 options. One is a closed reduction nasal fracture, which is pretty simple, or an open reduction if you wait too long. The time interval should be about up to 10, 12 days. After that, most likely you'll need an open reduction of a nasal fracture.